This conference will now be recorded.
There we go. We are going to wait just one more minute, I think, before we get started, as I can still see people logging on. Give me just another minute. Yeah. Okay. Danae, we ready? All right. Well, good evening. Welcome, everyone. My name is Ward Blackwell. I am the Executive Director for the Pennsylvania Dental Association. I appreciate everybody taking the time to join us this evening. It would have been really nice if we could have gotten all together in person. We'd love to have done that with all of our new graduates. Particularly, I would have liked that because I've only been here for 3 months in this job, and I love getting the opportunity to meet some of my colleagues and potential new friends every chance I get. Unfortunately, under the circumstances these days, pretty much everything you want to do is going to be Zoom or GoToMeeting. So that is what we have chosen as the format to bring to you something that you will find very important and useful in terms of information. And as was noted just a moment ago, we are recording the webinar tonight, just so that important information will also be available to any other new graduates who weren't able to join us this evening. So with that, I would like to introduce you folks to the presenters for tonight's webinar. In addition to myself, the current PDA president, Dr. James Talberg, is going to be covering a lot of the ground tonight about what has been going on during the pandemic. Our moderator this evening, Ms. Danae McNatt, she's the PDA membership coordinator. Dr. Rupali Kulkarni is the District 1 representative to the PDA's new dentist committee. And she'll be giving us a lot of good background as well from a perspective that might be a little bit closer to those of our new graduates. And we'll also be hearing from PDA's government relations manager, Ms. Kathleen Bumpers. Now, there are a couple of folks who are attending tonight, not necessarily speaking, but that I would like to recognize. Dr. Linda Himmelberger, who is the PDA's trustee on the ADA board. Ms. Joanne Nyquist from the Temple Kornberg School of Dentistry. She's the Associate Dean for Student Affairs. And I believe we also have PDA Director of Membership, Mary Donlin, on, although I haven't seen her picture yet. I thought I saw an MD come up somewhere there. So anyway, got quite a few folks listening in tonight that are important and may be able to chime in if necessary if we need some help answering some of the questions we hope to get at the end. Now, just so everybody is clear, the way we do this, with so many people on, we really can't have everybody's mic open in a free-for-all conversation. So we asked that only the presenters open their mics and speak when they're required to do so. For everyone else, as you come on, your mic should be muted. We ask that you leave it muted. That's not to say we don't want to answer your questions. We encourage that, actually. But to ask a question, you need to use the chat function in GoToMeeting. As you can see from the slide there, that kind of shows you a little bit about it. That balloon icon upper right on your screen is where you click to bring up the chat window. You can type your message there in the bottom where it tells you to type your message. And even below that, you can select exactly to whom it goes. If you send it to everybody, everybody can see your question, which is not a bad thing, because then that might be something that inspires somebody else to type a similar question. If you don't want everyone to see your question, but you do want it to be answered tonight, you can just select Danae's name there at the very bottom and send the message only to her, and she can ask the question for you when we get to that point of the webinar. Okay. that's pretty much it for all the instructions we have for tonight. So we'll get on with the program. And go to the next slide, please. First thing is to just congratulate you guys. Class of 2020, you not only survived 4 years of dental school, but you managed to finish while coping with an historic pandemic. So hats off to you. You've done a fabulous job, and we're really glad to have you tonight. But we're going to share with you some of the things that the PDA has been doing to cope with that historic pandemic as well, that you may not know about. And you might find kind of interesting, and particularly as you're going to be going out in practice, very relevant. So with that, I'm going to turn it over to Dr. Jim Talberg, and he's going to fill you in on a few of those things.
Well, good evening, everybody. First off, I'm really excited to share with you, my new colleagues, and with my other, we'll call them my co-conspirators at the Pennsylvania Dental Association. Actually, everybody working with the PDA has been absolutely fantastic. We have an amazing staff. Mr. Ward Blackwell is our new executive director. He jumped right in the middle of a pandemic, and without blinking an eye has just done an amazing job. For those of you who don't know, Mr. Blackwell had been the executive director in the state of Louisiana, where he was the executive director of Louisiana Dental Association for over 20 years. So he comes with us with a wealth of experience, and I must tell you that I'm not quite sure we would have handled things quite as well without having an experienced gentleman at our helm. Linda Himmelberger, who's our ADA trustee, means she represents the 3rd District, which is Pennsylvania, which is its own freestanding district at the American Dental Association. She has kept us informed and kept us up to date with everything that our parent organization, the American Dental Association, can do and will do and is doing for us. So we thank Dr. Himmelberger for all her work. Let me give you just a quick background of who I am. I am your current president of the Pennsylvania Dental Association. I finished my dental school training at the University of Pittsburgh School of Dental Medicine in 1982. I then did a general practice residency also at the University of Pittsburgh. And then I actually did an anesthesia residency at the University of Pittsburgh. At that point, I always kind of still wanted oral surgery. So being so Pittsburgh bred and born, it was time to get a little different perspective. I moved to New York City, where I completed an oral and maxillofacial surgery residency at the New York Hospital Cornell Medical Center, which is now called New York Presbyterian, as they merged with Columbia Presbyterian University. I stayed in private practice in New York for a year. So for those who are looking at associating, I did that. I will tell you, it was an interesting time associating. So I certainly understand a little bit what everybody has gone through. With that in mind, after about a year, I said, you know what, I really can't afford to live in New York anymore. And I moved back to my native Pittsburgh, where I opened up a scratch practice and clawed and grasped. And 33 years later, I'm still in practice. And I can tell you that, yes, I've definitely succeeded. So that's a little bit about who I am. I've been involved in organized dentistry since the beginning. Even while I was a resident, I still tried to attend local dental meetings, whether they were for professional associations, meaning for oral surgery, whether they were for local district meetings, or even for professional associations, such as I was a member of the Alpha Omega fraternity and went to Alpha Omega events. But again, I wanted to see what was going on out in the world, whether it be in Pittsburgh or New York, or again, back in Pittsburgh. I've been involved with the PDA almost since I got back, and have held other offices here, such as vice president, secretary, and of course, president-elect and now president. So let me tell you a little bit about some of the resources that were available to us, both through the ADA and the PDA during this pandemic. This has been historic. All of you know that. Amazing times, just never experienced by me. And I did my training in New York for oral surgery during the HIV epidemic, where people still had no idea what that was all about. But this is something totally, totally different. I must tell you that it was really a wonderful collection of people at the American Dental Association who provided great guidance for us, and then through Mr. Blackwell and our wonderful staff, many of which who are represented here tonight, we were able to do similar things and expound upon those through the Pennsylvania Dental Association. So at the American Dental Association, one of the best things they did, and it came out early, was a return to work interim guidance toolkit. This was guidance that listed almost everything you would need to know, from how to deal with patients, how to deal with your staff, how would you provide appropriate pandemic care for both the office, for yourself, and for safety sakes. It listed every supply you could imagine of how things would be available for us. It was an amazing toolkit. It became actually my standard bearer in my office for what we would use as a basic return to practice. I think anybody who was able to share that found it to be an amazing tool. The ADA at the time felt the need to make sure that even non-members could gain access to the toolkit, and it was made available to everybody. So the ADA was looking out for dentistry in general and not just for their members during that time frame. There was a distribution of free PPE, which was obtained by the ADA through FEMA. I will tell you that they have been wonderful in their discussions with FEMA, and we'll get on to who else they've talked to help us return to practice. But FEMA, the Federal Emergency Management Authority, made available 3M made KN95 masks. The ADA were able to get this, and for simply the cost of shipping and handling, we were able to get free an allotment of 3M made KN95. So it was a real wonderful thing to do, and I believe 30-some thousand people, I think, if I'm correct, Linda, you can shake your head on that one, took advantage of this program nationwide. So what a wonderful thing for the ADA to do to help us get back in practice. By the way, that is just a very, very small representation of things, and due to time, we could talk for hours, honestly, at end of what the ADA has been able to do for us, not just during the pandemic, but at all times. But for right now, let's move on. Let's talk to you a little bit about what happened at the Pennsylvania Dental Association. Through the guidance of our wonderful staff and Mr. Blackwell, our new ED, we developed our own back to work interim toolkit. It was very specific for what we needed to know here in Pennsylvania to practice. So along with the ADA toolkit, which gave you general guidance, now we had very specific guidance for what would be necessary for practice here in Pennsylvania. That included at the time employment information for practice owners and for the employee dentist. So as a new dentist out there, this was something that was very important, so you would understand what was going on, not only for you as the employee, but what was really going on from the practice owner's standpoint and how they were looking at their employee dentist. In addition, we had a list of vetted fit test vendors, places you could go to have your KN95 or N95 fit test to make sure that while you were seeing your patients, you were as safe as possible, and a list of PPE vendors. And this wasn't just any old list. This was a list that the PDA staff actually looked at, vetted, and determined that these were appropriately safe, good vendors who were selling you good merchandise. They weren't merchandise carriers who might have been artificial, if you will. People who were saying they could offer things and you would never get them, or would take months and months to get the PPE that you needed. So I thank the PDA so much for providing that for us. In addition, we had a PPE store actually online through the PDA. This was made available through the Pennsylvania Dental Association's website. It listed everything from face shields to gowns to gloves to masks, both 2-ply, 3-ply, N95, KN95, pretty much you name it, we were able to offer it. Along with, through the PDA, we've been offering supplies through our vetted vendors for quite some time. And most importantly was through the KN95s, the Pennsylvania Dental Association developed a fit testing group where you could actually get your N95s. So in the early days of the pandemic, in order to practice in Pennsylvania, one needed to have KN95s for you and your one staff person to see these emergencies that were allowed through the Department of Health here in Pennsylvania. So we were able to organize a company called Mobile Health, and they were able to go all around the state. Initially, I believe it was 6 areas, then followed up in approximately 4 areas. And we even offered a third round that wasn't taken up by many but we offered actual fit testing and we offered KN95 masks that you would get as part of your fit testing. It was really a wonderful experience to see everybody taking advantage of it. And I believe we ended up serving over 1,200 individuals in Pennsylvania through this program. With that in mind, we could talk for hours more about what the PDA has done, and we'll do more as we go on through tonight's webinar. Mr. Blackwell, may I return the podium to you?
I appreciate it. Thank you very much, Dr. Talberg. And by the way, I should mention to everybody that the very successful fit testing program, that was Dr. Talberg's brainchild. So hats off to you for what was a phenomenal idea at a critical time.
My pleasure.
Andrew, if you'll bear with me for just a minute and linger on this slide, I'm going to catch up on a couple of announcements since we've had a lot more people join since the webinar officially began. Just a reminder that everyone's mic should be muted as you come on. Please don't unmute. We're trying to keep this orderly. There's just too many people to have everybody talking at once. But if you do wish to ask questions, you can use the chat feature. Click on the little cartoon balloon icon upper right on your screen, and that opens a chat window, and you can type your questions there. We'll answer them as we can. And a couple of things I was remiss in not saying at the beginning is after the webinar, we'll be sending a survey to all the new graduates who are participating tonight. All of you who complete the survey and have submitted a membership application to PDA, either previously or do so this week, will receive 5 of those KN95 masks that Dr. Talberg was talking about that we got for our members for free, as well as a drug reference book. In addition, just for being part of this tonight, you're all going to be eligible for a drawing to receive a copy of Meditation for Your Life, Creating a Plan That Suits Your Style. Really fantastic book by Dr. Robert Butera. So some really great incentives and fun stuff that you guys are getting, in addition to all the great information, just a way of showing our appreciation to you for giving up part of your evening to join us. Now, back on to some of the stuff that we've been talking about in terms of PDA's activities during the pandemic. The most obvious impact on dentistry during the pandemic were the new rules that were imposed upon practices by the Department of Health. They wound up issuing 3 different major documents that provided guidance to dental practices. I'm just going to say with the first one, maybe they weren't totally clueless, but it kind of felt that way. Essentially, dentists were going to have to practice in negative pressure rooms with equipment that nobody in the state had, few hospitals had. It effectively shut down dentistry in the entire state. The PDA lobbied really hard, and Dr. Talberg again took the lead on that. Took a little while, but pretty quickly in the grand scheme of things, dentistry was reopened in Pennsylvania. They backed off on that particular piece as far as the negative pressure rooms, but it was limited to only essentially emergent cases and urgent cases for some time. Then came the second major guidance document, and they went from totally clueless to maybe somewhat unreasonable. This was littered with a lot of meaningless terms that were very difficult for dentists to interpret. So we had a pattern that had been developed by this time of dentists who were very upset and seeking answers every time a piece of guidance came out from DOH. Well, with the third time, we stepped in and said, we're not letting this happen again. And PDA issued a very explicit, very detailed, but also very clear evaluation of the third guidance, which essentially is what we're operating under now. And most dental practices are able to do pretty much what they want to. This is partly because, well, frankly, the terms got a little bit better. They were just hard to figure out. But as we pointed out, there are 2 really key points of things that were required. You had to comply with the Center of Disease Control interim infection guidance. That was specifically laid out, new guidance from the CDC that related to practices that were transitioning from emergent and urgent only cases to more regular practice. The whole idea was to be still very careful about taking the correct precautions to prevent transmission of COVID, but still providing the oral health care that needed to be provided for the population. Surprisingly, the department even allowed that in certain situations, CDC standard precautions, which is essentially how dentistry had been practiced for many years before that, might even be allowable at times. This was pretty critical to make that distinction. And the second major takeaway that we had from the new guidance was that essentially you have to take some responsibility for who comes into your practice, looking at universal source control and actively screening your patients. You don't want to unknowingly have a COVID positive patient in the chair. That seems like common sense, but that was not really clearly stated as we read the guidance. Now, there were a couple of points of things specifically not noted in the guidance that we felt was important for our members to know. One of those was it did not stipulate very specific statistics or numerical metrics for making the clinical determinations that the guidance gave our members the freedom to do. Case in point, many people were concerned that you actually had to be aware of a specific number of COVID cases in your county to determine what procedures you could do, or you could only do procedures that, use particular instruments, or you might have to have a calendar measure for determining how long you could delay treatment for certain patients. None of that applied. It was strictly clinical judgment of the practitioner that made those determinations. And even more confusing for many people, because we've all become so accustomed to everything being green, yellow, red. I mean, how long have we in Pennsylvania been thinking in terms of green, yellow, red zones, determining everything we can do? This guidance totally threw that out the window. Once our members kind of got past all that, we were able to boil it down to a very simple bottom line. Here's what you need to do. And it was very simple. Once we had this out there in the second update to our toolkit, you do three things. Follow those CDC guidelines, monitor the trends of COVID counts in your area so you have some idea what kind of population you're dealing with. That's part of the active screening process. And then, as you probably always should, consider the risk to your patient of deferring care and consider the risk to your team of transmission for treating any particular patient or providing particular service. Simple as it can be, leaves everything essentially to the judgment of the practitioner, and all of a sudden dentists were back to work in a way where they could breathe a sigh of relief and their patients could get the care they needed. This clarity that we were able to bring, I think, was tremendously helpful. And ultimately, I think it was kind of helpful to the department too, because they stopped getting so many phone calls. Now, this was all included in that PDA toolkit that Dr. Thalberg mentioned. And the real important takeaway, I think, here is the toolkit was kind of in a microcosm, exactly what the PDA is all about. Making it easier for dentists to do what they need to do in order to be successful doing what they want to do. Now, I'm going to tell you, not everything was related strictly to DOH guidance in that toolkit. There was tons of other information, everything from employment issues to guidance on where to buy PPE, things like that. But I'll give you a quick example of one critical thing that answered a lot of questions for our members. That was informed consent. Now, since y'all are basically just now starting out into practice, you probably haven't given this a whole lot of thought, but at some point in your career, you're gonna have a complaint filed against you, and at least a good number of you are probably gonna have to go through the process of a professional liability lawsuit. Hopefully they get tossed out early on in the process, but yeah, it doesn't always happen that way. Your first line of defense in any kind of action like that is good informed consent. Now, all that means is that you have gone over with your patients, what can go wrong in a procedure, kind of the worst case scenarios. given them the opportunity to ask questions, and you've documented it, typically by actually having them sign a form. Now, most of our members were concerned, do we need another form for COVID? That could be some potential new liability for us if somebody were to become positive after they visited my practice and then they want to sue me. Go ahead to the next slide, please, Andrea. Well, we put that question to our attorneys so we could get a good answer for our members and include that in the toolkit. The attorneys actually work for the dentist insurance company, which is a professional liability carrier endorsed by the PDA. And one of the most common questions we got was, do you need another form specific to COVID? And their answer was no. You basically want to stick with specific procedure forms, as you always have. Do all the important things you always do about going through everything about that procedure, what the patient needs to know, and getting a signature on that. You don't need a separate COVID form. Next slide, please. However, you do need to go over specifically with the patient what you're doing in your office to limit or improve the safety while limiting transmission opportunities. Things like the screening of patients you're doing, the temperature checks, the infection controls. Maybe you've got some new procedures where you're wiping down everything and you're trying to change the rooms over at a different pace, so you have time for anything that is lingering in there to be, completely falling to the floor and cleaned up. And of course, you're going to have a lot of PPE, way more than you used to have in the past. All those need to be gone over with the patient, explain how that protects them, and give them a chance to answer questions about it. Then document that on your chart. We had this very explicitly spelled out in the toolkit. All those questions members had about that were then taken care of very easily. It's just one example of how the PDA was able to address a very specific need of our members in that very valuable document. Now, with that, I'm going to turn it back over to Dr. Talberg and let him kind of wrap up on some of the things that were going on where we're talking to people other than just our members.
Thank you, Ward. So let's talk a little bit about what's gone on since the pandemic, which we're talking about beginning roughly in March and taking us to roughly end of May, early June. And we'll tell you a little bit about the PDA advocacy in the media. So from that time of roughly around March 25th, going up to about, let's say, May 29th, at least 20 times the PDA was featured in various television reporting, newspaper reporting, radio reporting, internet reporting. And so in the following next two slides, you'll see a number of different outlets that we were featured in. And it wasn't just the people you see presenting to you today. Some of our incredible members were interviewed and gave incredible impressions of what modern dentistry and how a dentist thinks during a pandemic and how they respond to the patient's needs and to their staff's needs and to their own needs to provide safety and top quality dentistry during that time frame. So it isn't just a matter of taking care of our own, but it's letting the public know what we do. And so if you take a look at the next two slides, you'll see a number of different things. Some of them were focused in areas or different locations around the state districts. Other ones went actually statewide. So I'm not going to pick one specifically, but they were all amazing. The websites are listed here, or ways to get onto the site to see what we all talked about. And I encourage you at any time to please look at these and go on and see how we spoke glowingly of the Pennsylvania Dental Association. I believe that you will receive a PDF to access these links after the webinar today. Let's talk a little bit about some of the legislative initiatives that we've done. There were legislation initiatives both at the American Dental Association and at the Pennsylvania Dental Association. And just a small representation of what went on. But the bottom line is if there was one voice that was the most important voice during this entire pandemic in Pennsylvania, it was the Pennsylvania Dental Association. Why? Because we represent the most dentists. And therefore, we are the voice. We are the trusted voice. We are the ethical voice, the moral voice, and that trusted voice again that provides information that if you want to know what's actually happening, you listen to the PDA. There were some other groups out there that posted various bits of information. Some of it came out premature. Some of it came out without being vetted. We always just gave it a small, tiny delay so that we could actually look at the information and make sure what we posed to everybody was accurate. So if you're looking for what does the PDA do for you, it is actually all these things that we're talking about and more as we go on, but we provide that voice in dentistry. So let's talk about a couple of the things we did. At the ADA level, the ADA was incredible at both lobbying the Centers for Disease Control constantly and making sure that we had the latest information and they understood what the practice of dentistry was and needed in order to practice during a pandemic, and that what needs we had to have and what we needed to do to make sure our practice were safe and following CDC guidelines. In addition, the ADA lobbied FEMA, as we talked about. We were able to get FEMA to go from dentistry being a little lower on the list of priorities to all the way up to number 4. That was behind simply hospitals, nursing homes, and first responders in Pennsylvania. The number 4 most needy area was dentistry. And I really thank the ADA for getting us to that position. That gave us a big time importance for how everybody else was looking at us. They were very successful in getting the United States Department of Health and Human Services, known as HHS, to let Medicaid dentists apply for financial assistance. It's hard enough to practice in a Medicaid environment, but to make sure that those people practicing were able to get the best assistance possible to continue not only their practice, but to take care of those who were needy and underserved was just miraculous. And it was wonderful stuff. And I thank the ADA so much for doing that. As far as the PDA goes, we got, of course, as Mr. Blackwell already discussed, we got the reopening of dental practices after what was basically a statewide shutdown. We worked through this lockdown period on reopening issues with what we had for the Pennsylvania Dental Association, our Health Crisis Task Force. But more importantly, I want all the students to understand this. We worked with a coalition to talk to the Department of Health. The coalition included each of the deans of the 3 major dental schools in Pennsylvania. So that was Pitt, Penn, and Temple. They were part of our coalition, along with the Pennsylvania Academy of General Dentistry, the pediatric dentists, the dental hygienists, and we were able to all get together and discuss issues with the Department of Health almost on an every week to 10-day basis to get us back into practice. I will tell you again that we really worked hard with your dental schools, and we continue to do so and had continued to do so during the entire pandemic and will continue to do so to make sure that needs of students are heard and felt and work together, both in organized dentistry and in academic dentistry. We also looked at, very importantly, which was immunity for healthcare providers. So Governor Wolf had an executive order that applied to healthcare providers who treated patients for COVID-19 related illnesses. And you had immunity. If you saw one of these patients and something happened, everything was good. In addition, we have been lobbying and pushing for further immunity, just for the idea that if you could not see your patient because the Department of Health said that you needed to have certain things in place to see the patient, you would have immunity that if the patient ended up having their problem get slightly worse because you were unable to see them, you would have immunity knowing that it was part of the Department of Health's mandates, not something the dentistry did, and we're working on that to this day. Lastly, we're working on opening up the dental books for dentistry to be able to do diagnostic and antibody testing. So we hope to soon introduce legislation that authorizes dentists to order and administer diagnostic and antibody tests, which include COVID-19 testing to patients for the purpose of making clinical decisions. I can tell you that from personal information that Ward and I talked about today, we think we might get further help through our State Board of Dentistry, and we believe that we might be able to open this up to all kinds of testing and providing vaccinations for HPV, which we see, of course, in the oral cavity, let alone vaccinations for the flu even. We are healthcare providers. We are doctors. We need to be able to be treated as such and provide the appropriate medical testing and diagnostic testing that's necessary to provide the medical needs for our patients. Let's go to the next slide here. And let's talk a little bit about some of the PDA lobbying. Some of the things we're doing is we're fighting for PPE. We really want the Department of Health to understand that we need PPE. Now, I will tell you, we've written letters, we've talked to them verbally, even though that FEMA has now made us number 4 through the hard work of the American Dental Association. The Department of Health and PEMA, the Pennsylvania Emergency Management Authority, unfortunately says that their supplies are not as robust as they would like them to be. And at the current time, they're not allowing us to feed into the FEMA provided to Pennsylvania PPE. However, they've told us that we are able to go to the business-to-business network and go on the free market to get what we need. We've continued to look at various avenues to provide those to our members through our PDA website, but we haven't given up. We continue to fight with the DOH and with PEMA to, as supplies increase, to get some of that hard-needed PPE for dentistry as well. I do ask all of you, as you provide as new members here in Pennsylvania, to urge your legislators to contact the Department of Health and PEMA on behalf of dentistry to make sure that we have adequate safety measures and safety supplies available to us so that we can provide the proper care to the public. We have continuous communication with policymakers and the media for both these purposes. Another important thing is we're looking at ways to expand student loan relief. We're looking at, I think there's one other thing I wanted to tell you about. Yeah, let's find this little piece of paper here. We're looking at, through the ADA, to get tax credit for what you may have to spend for what you need to do for safety measures based on PPE in your office. That could be anything from ventilation systems to UV systems to sneeze guards to aerosol fogging to disinfection, let alone all the PPE equipment you have to have. So we're working on a number of different things to get, and again, for all of you students, the most important part is we're looking to try to figure out ways to expand student loan relief as well. With that in mind, let's move on a little bit further. Let's go to Kathleen. Kathleen, if you wouldn't mind grabbing the podium and talk a little bit about licensure updates.
Thank you, Dr. Tauberg. Again, my name is Kathleen Bumpers, and I am the Government Relations Manager here for the Pennsylvania Dental Association. And I just want to take a few minutes to talk about some of the licensure updates that have been made that are related to COVID. So, along with everything else in this pandemic, we've needed to find new, we've needed to find different, and we've needed to find safer ways of doing things. So with that in mind, the State Board of Dentistry needed to figure out a way that they could accommodate new applicants for licensure that were unable to complete the in-person requirements that they needed to meet in order to obtain licensure. So the Department of State petitioned the governor's office for a few waivers for suspension that were related to different licensure requirements, and those some of those waivers and suspensions were approved by the governor's office. The first one that I wanted to talk about is in relation specifically to the live patient clinical exam. So for this licensure, for 2020, any new applicants coming to Pennsylvania, the periodontal and scaling portion of the clinical live patient exam has been waived. So anybody who is applying for initial licensure as a dentist in the state of Pennsylvania will not need to complete the periodontal portion of the clinical exam. In addition, the State Board of Dentistry is accepting a temporary substitute for the restorative portion of the exam. So what the State Board of Dentistry is allowing temporarily is the ADEC non-patient-based restorative exam, which is being administered by the CDCA and the CITA for the 2020 administration of the clinical exam. Sorry about that. So the applicants, any applicants for initial licensure can still opt to take the live patient exam if they wish. If they have already taken the live patient exam, or they opt to wait until the exam centers open back up, the State Board of Dentistry will still accept those results for licensure. So other states are making the same decision as Pennsylvania to either waive or suspend the live patient requirement due to safety concerns because of COVID. And the elimination of the live patient exam, it just provides a safer way for dentists to continue to become licensed in the state of Pennsylvania. Another requirement that has been waived that will apply to initial licensees is the CPR requirement. So anybody who is applying for initial licensure in the state of Pennsylvania as a dentist will need to have a CPR course that covers infant, child, and adult CPR. That CPR requirement has to be done through a hands-on course. However, for temporarily during COVID, the State Board of Dentistry has suspended the live hands-on requirement, and they are currently accepting online courses as acceptable in order to gain your initial licensure. Now, having said that, 2021 will be a licensure renewal year, and in order to renew your license in 2021, at least for now, you will have to have a hands-on course completed in order to renew your license in 2021. And I believe that is all I have.
Great. So just to transition a little bit, as I know you guys have been receiving a lot of great information tonight, we're living in such a unique time. And so I think it was really important to hear from, PDA staff and leadership about what organized dentistry really is. And for those of you who don't know me, I recognize a lot of names that have joined the webinar tonight. My name is Rupali Kulkarni. I graduated from the University of Pennsylvania just last year, and I am currently in my second and chief year of oral medicine at the University of Pennsylvania. So for me personally, my organized dentistry journey started when I was a first year in dental school. I had the opportunity to work with a number of PDA and ADA leaders, and I just finished my term this year as the National Immediate Past President of ASDA. So for those of you that have joined, I know a number of you were involved in ASDA, throughout dental school. And so how does that really change, as you enter your professional career? So I think what's really important is the information you have received has really shown the value of organized dentistry. And when you're transitioning into a new career, I think it's so important to remember a sense of community. And for me, that's how I was really able to get through dental school, and how I know I've been able to, pursue what I've been interested in even after dental school. So I thought it would be nice to transition a bit into some of the resources that are available to all of you as new dentists at both the ADA and the PDA. And for me, I use a number of these on the daily. So a lot of what you've heard have been initiatives that have been, in direct correlation to what's been going on. But I think some of the things that I'll be talking to you about in this segment, you'll be able to use on a daily basis. And so I think that's one of the greatest things, is having not only that intangible of community and that sense of support, but also the tangible benefits as you continue to transition, whether it's straight into practice, owning versus being an associate versus if you're like me who's doing residency. I think there are resources that are available for no matter what you're deciding to pursue moving forward. So as you can see listed here on the slide, there are a number of resources that I just want to highlight. And so specifically looking at the American Dental Association. So the American Dental Association has something called the Center for Professional Success. It's actually something I use. So if you go to the ADA website, you can actually search for it. And they have great resources, webinars, and just tangible tips for first helping you to manage really your finances. You know, there's no secret that there's a huge financial burden, you know, moving forward, you know, attempting to pay back loans, you know, trying to dive into practice. And so there's really tangible tips on how to best manage your finances. Just day-to-day practical advice, especially if you're, you know, joining a practice and you're trying to maneuver, you know, through staff, how to develop your leadership skills and work in a new environment. And then for me personally, I'm really passionate about this idea of work-life balance and really incorporating wellness. And so they have a really great wellness section, tips that you can incorporate into your daily life. So that's something I would highly recommend looking at. You can just search for it on the ADA website. Something that's on the rise, many of you have probably heard through your dental schools, is the ADA Practice Transition Program. And it's kind of an interesting program. I'm sure Dr. Himmelberger can talk more about it if you have questions about it. But it's essentially like a match for new dentists or looking for practices and seasoned dentists who are looking to sell their practices. And they basically match you on practice philosophy. And so you essentially create, you know, your own profile, and you get matched based on, you know, questions that you answer looking for, you know, similar practice philosophies. And I think that's a really great idea that the ADA came out with, and it will be made available soon here. So they've piloted it in several states, and I think it's been very successful. So that's exciting. And then in terms of finances, both the ADA and the PDA have resources for student loan refinancing. The ADA specifically has the Laurel Road student loan refinancing program, and you can see here on the slide that members receive a 0.25% rate reduction. All the details about the program itself are listed on the Laurel Road section of the ADA website. So once again, would recommend looking at that. Same thing, similarly, for the PDA SoFi student loan refinancing, PDA members also receive a percentage of rate discount. So once again, I think it's great to be able to have access to these resources as we are continuing to navigate such a difficult time, and especially with the unknowns of finances currently. But in terms of the PDA, you know, we're just starting out, and, you know, we're in an exciting time, but like I said, we're also in a difficult time. And so there are a couple of great resources that the PDA has, especially for transitioning into our professional life. So one of them is the placement service, and that is for members only, and it's actually a platform for job search. So once again, it's connecting you know, dentists, newer dentists, as well as seasoned dentists looking to either seek employment or purchase a practice. So you can enroll in that on the PDA website. It gives a, you know, a lot more details about you know, who can essentially sign up for it and how do you sign up. It's something to definitely look into if you're still searching for the right place to work, which I know many of you probably are. In addition to that, there is a mentoring program, and it's not only available for new dentists, but dental students as well, and pairs up new dentists and more seasoned dentists based once again on kind of philosophies, area of interest, specifically in dentistry, as well as location. And a great way to, number one, build your network, meet people, but also feel comfortable, you know, building a relationship with someone and being able to ask them questions directly about, you know, their, you know, professional career and what different routes you can take. Online CE. So, you know, as we've talked about licensure as a whole and the requirements, different things that we have to complete, one of them, of course, is our CE requirements. And so some of them already are available online that you can complete towards your requirements. The child abuse one will be made available soon. And then the one thing that I'm really going to plug, because it's something I use quite frequently, is actually the PDA Go app. It's probably one of the most comprehensive apps I've seen. I know many of you, if you were involved in different associations, they might have released apps, but the PDA Go app is very user-friendly. There's a lot of tangible resources on it, especially for new dentists. There's an entire new dentist section. There are ways to interact with dentists on the PDA Go app as well. There are forums where you can, you know, ask questions and engage in dialogue. There's an entire checklist specifically for licensure. But I think what's really great is a lot of what was mentioned in the presentation already in terms of, the COVID-19 updates, as well as some of the resources that I've mentioned, they're actually available on the app as well. So I would highly recommend going to your phone and downloading it, and setting it up and interacting with it, just taking a few minutes to go through it and see what's available. Most of my questions that I was, looking for, especially just as I continue on and finish up my residency, and as I'm interested in kind of finding where I want to go, there were a lot of great resources just available on the app itself. And like I said, a great way to also interact with new dentists as well as seasoned dentists, and if you have specific questions. So that is my big plug for PDA Go. Definitely recommend downloading that. But yeah, so lots of resources available to you. And I think that's one of the things that can be challenging, is trying to navigate them. So definitely reach out if you have any questions. The one thing I can say, like I said, is being a new dentist myself, being in this difficult time, I've really much appreciated the amount of support and mentorship that's been made available. So looking forward to connecting with you guys, and looking forward to your questions at the end. But I know that I will turn it over now to Dr. Tauberg. I'm sure he's going to chat with you a little bit more.
Thank you, Rupali. Let's talk for a second about what membership entails. And we are lucky enough to have what's called a tripartite membership structure. That means when you join the PDA, you're actually joining the ADA, so at the national level, the PDA at the state level, and actually at your district or section of the state that you're in, plus all the way down to maybe the individual town or city called the local level. So actually in Pennsylvania, it's more than tripartite, it's quadpartite. So you actually get 4 different levels. I can assure you that through the national level, you're dealing with the ADA, you're dealing with the House of Delegates, the annual meeting. We have Dr. Himmelberger representing us. At the state level, we have 2 different ways actually, and actually one that's more district level, which is our Board of Trustees, which has somebody from every different district in our state. There are 10 districts that make up Pennsylvania. Within those, we have locals or other areas. We run those through what are called our Council of Presidents. And we have been in contact with both our Board of Trustees all the time on our SONET, which is our way of talking to each other all the time, even pre-pandemic, through the internet. But we also have periodic meetings, at least quarterly, with our Council of Presidents. And of course, at all times through our PDA Go app, which Rupali just mentioned, we have forums to talk about issues from all over the state, from every single member. So if there's anything I can tell you, is there's no other organization that's able to provide the range of information and help and affect change than the ADA, PDA, and our state and local levels. Nobody can do what we do. We actually are the people that make things happen, that make things move, that make things change for our profession. I really encourage you all to apply at ada.org/signing day. And remember, when you apply and join now, not only are we going to offer you through the PDA 5 KN95 masks, but you'll also get the ADA electronic dental drug book. And we're also offering a raffle prize for those who are signing up, which is a copy of Meditation for Your Life, Creating a Plan That Suits Your Style by Robert Butera, PhD. It's a great read to let you know what's important between your life and dentistry. I want you to know that when you join the ADA, your membership for the first 18 months out of dental school are at no charge for both your ADA and PDA dues. Though in some other states that might differ a tiny bit in terms of their states and local structure. But at the PDA, you get the ADA and PDA dues free for the first 18 months. And graduate students always pay $0 of national ADA dues for the entire duration of their programs. With that in mind, I think we've held everybody's attention for almost an hour. And so I'm going to ask if there's any questions. I saw a couple pop up perhaps on the chat line. Danae, do you have any questions out there that any of us can answer?
I just received one. It's from Leslie. Their question is, if you already signed up for the PDA/ADA as a class of 2020 member, will we also be entered into the raffle, or is it just for those who have not yet enrolled? I can answer that one. So the raffle prize, the Meditation for Your Life book, is actually the incentive for attending the webinar. So it doesn't have to do with whether or not you have become a member or not.
Leslie, I hope that answered your question. Are there other questions from any of our viewers? We've offered a lot of information. Again, please understand, this is just a very small portion of what we are constantly doing, on a day-to-day basis, sometimes even on an hour-to-hour basis. So I encourage you to join. This is who represents you to the government, to the state board. We are the Pennsylvania Dental Association, and we are part of the ADA, the American Dental Association. I certainly suggest any of you to share feedback with us in regards to the webinar tonight. I hope you've all enjoyed it and got a little idea of what we are doing for you and how we are part of you, both at the student level and especially as soon as you get out and become a dentist here in Pennsylvania. With that in mind, I open this up to any of my other presenters tonight. Anything any of you would like to say and add to the final ending?
Jim, if I could.
Please, Linda Himmelberger, please.
Yes, well, a couple of things. I think it's always a little bit confusing for people, when they hear about tripartite membership. And I think one of the things that the presentation tonight really made clear is that how valuable it is to belong to an organization that works nationally, statewide, and locally. The ADA's lobbying efforts could only be accomplished by a nationwide organization. What the PDA did for members in Pennsylvania could only have been accomplished through a statewide organization. And as you go forward, you'll see that the locals and the districts provide you with a lot of camaraderie and opportunities for mentorship and engagement, so that, as Jim said during his presentation, this tripartite organization, even though it seems a little cumbersome at first, really helps to address the wide range of issues. The other thing I'd like to mention is that we talked quite a bit tonight about the lobbying efforts that we did in Harrisburg and the lobbying efforts that took place in Washington, D.C. through the ADA. And as you get involved in organized dentistry, you'll hear about PACs, you'll hear about ADPAC and PADPAC. And those are our lobbying arms. And some people are a little reticent about PAC money. It seems like we're trading votes for dollars. But that's really not the case. The PAC money gives us access to the people that we want to speak to, our representatives, our congresspersons, the various stakeholders, so that it opens the door for us to be heard. Otherwise, the door may not be open to us. They may not always vote the way we want, but we want to at least have the option to be heard. One of the things that Ward and Jim both alluded to was when the first guidance came out from the Department of Health advocating for negative pressure rooms, which nobody had. One of the things that turned the tide was certainly the efforts, lobbying efforts of the PDA, but it was also member dentists calling their legislators, member dentists calling the Department of Health, so that as you transition from school into practice, I would encourage you to become involved and become active, because every voice counts. And when every voice is heard, we can really make a difference. We can move mountains. We can get the Department of Health to back down on guidelines that really were nonsensical. So I'm excited for all of you to be here this evening. I'm excited for all of you joining this fabulous profession. All of us who are practitioners, seasoned practitioners, I love that word, Rupali. The seasoned practitioners on this call will tell you that it is just an incredible profession. And welcome everyone to this incredible profession, and welcome to this incredible organization.
Thank you, Dr. Himmelberger. Just a couple of quick ones, and I see Danae's on the chat box. The raffle is only for the book that is about meditation for the dental practice. Otherwise, at the end of tonight's webinar, please fill out your survey, and you will receive your 5 KN95 masks, and you'll have the option, of course, on that survey to receive a hard copy or electronic copy of the dental drug book. So please make sure you fill out your surveys at the end tonight. In the meantime, I want to thank everybody who presented tonight. I want to thank everybody who attended this webinar tonight, and I want to welcome you again to the Pennsylvania Dental Association, to the American Dental Association, which are your organizations. So thank you, and we look forward to having you become involved, because your involvement is what makes the entire organization go forward. Thank you, and have a really great evening. Always be well and be safe.
Thank you, Dr. Talberg. By the way, Danae, this webinar was recorded. I believe it will be available for other students to be able to watch as well. Other new graduates, I should say.
Yes, so we're going to make it available and have it on PDA's website and hopefully on PDA Go. So everyone, please download.
Terrific. So we hope that everybody who enjoyed this night will let your classmates and other fellow new graduates know, and encourage them to check it out as well. With that, we wish everyone a great evening and a great career. Look forward to seeing you soon.
Bye, everybody.